I was worried, and I think many of us were, many international organizations were at the early stages of this pandemic, that coronavirus was going to rip through refugee populations and it would be a humanitarian disaster. So far, haven't heard very much about that at all. Why do you think that is?
So there's a lot of pros and cons in this situation, but yes, the health impact has been less catastrophic than we thought. Refugees are all over the world. Refugees, displaced people, there's about 80 million of them. They're on all 5 continents, all situations. And I think that they have been impacted health-wise by the coronavirus, just like the populations they live with. Usually they're host populations. So you have many Venezuelans in Latin America really testing positive wherever testing exists and is available, but you have in other parts of the world less impact. And I have to say one thing which is difficult almost to explain. We've been campaigning very much in the last 5 years against ghettoizing refugees, against closed refugee camps, against places where they're confined. However, since many of those places still exist, it was easier to control the pandemic there for obvious reasons, but at a cost that is not sustainable, at the cost of everything, their livelihoods, their ability to move, and so forth.
I mean, we know how much political opposition there has been to the accepting of refugees well before coronavirus. Has this created significant additional changes, or were borders sufficiently closed to most refugees beforehand, especially in the advanced industrial economies, that frankly, the pandemic didn't have much additional impact on movement?
I would say 3 things. The health responses so far, we're not yet in the vaccine world, which will be completely different. But up to now, we have not seen discrimination, because I think every government, even the most reluctant to accept refugees, and there are many, is aware that if you exclude a whole group of people from treatment, prevention, etc., you put everybody at risk. So there was inclusion there. There was quite a rise in border closures, which, of course, to an extent we understood. Borders were closed for everybody, not just for refugees. So we made pleas, we work with governments to ensure that people fleeing for their lives, the most urgent cases, could still be admitted to asylum procedures. And this, we're slowly getting out of that, but we're worried that some governments will use the excuse to keep borders shut for refugees and asylum seekers. My main worry is the longer-term impact of the pandemic that we all know worldwide will be on the economies, on people's livelihoods. And refugees, displaced, stateless people are very vulnerable because most of them depend on the jobs that are the first ones to disappear in lockdowns. So that's where I'm worried, and I'm also worried that when these big rescue packages for the economies are put in place and implemented, then political considerations will prevail and maybe refugees will be excluded. Working together can produce the shared solutions that is the only way to address migration, refugees, but also the pandemic. So, there's a lot of parallelism, not to mention climate emergency and all that. All these are global issues that require global responses.
So, Filippo, you gave us the basic numbers, over 80 million refugees forcibly displaced. Those are the largest numbers of our lifetimes. And it seems that there's no reduction in sight. What are the principal drivers of that expansion right now?
Conflict, discrimination, persecution, I would add, in a language that was not used at the time of the convention, bad governance, are very important drivers, and the traditional one. The complication of the last, 10, 20 years is the combination of this with other factors that are less traditional, like economic factors, inequality, poverty, the demographic factor combined with poverty that makes richer countries more attractive, and the increased mobility that allows people to move on, sometimes using asylum channels, even if they're not really refugees. But everybody's moving because of some sort of vulnerability. And now in the background of all that, or on top of all that, literally, or around all that, you have the climate emergency that is also likely to compel people to move. So unfortunately, I am not optimistic on numbers. I've been in this job for 5 years. We've seen every year an increase. We estimate that in the past 10 years, this number, the 80 million, has doubled.
Shortly after this interview, High Commissioner Grandi tested positive for COVID-19. He says his symptoms so far are mild. We wish him well.